The final rule of triggering thought processes that we're going to look at is that of framing. Take a look at these two images. If you saw these hanging on a wall, which would you think is most likely to be the genuine article? The one on the left or the one on the right? Of course, it's exactly the same image. They've just been framed differently. But the way we frame something affects our perception of the contents and how we approach or avoid it. And that includes our messages. In this experiment, people coming out of the cinema were asked what is essentially the same question. But the question was framed differently. How long versus how short? It was exactly the same movie, but those who asked how long it was overestimated the length of the film, and those asked how short it was underestimated it. Different frame, different perception. Framing applies to health messages too, where framing it differently will lead to a different response. In this experiment, 3 different pamphlets on breast self-examination were given out. The first pamphlet was framed in terms of gains for carrying out self-examination. The second was framed in terms of losses. And the third pamphlet omitted this paragraph altogether. The difference between these 2 paragraphs is highlighted here. The gain frame said, by doing breast self-examination now, you can learn what your normal healthy breasts feel like, so you will be better prepared to notice any small abnormal changes that might occur as you get older. Whereas the loss frame said, by not doing breast self-examination now, you will not learn what your normal healthy breasts feel like, so you will be ill prepared to notice any small abnormal changes that might occur as you get older. Which of these paragraphs do you think was most effective in changing people's behaviour? It turns out that it was the loss frame that was 1.5 times more effective. The gain frame was even less effective than not including the paragraph at all. So this is an important lesson for us, because it tells us that if we get the message wrong, we end up doing more harm than by not putting the message out there at all. We need to understand that people instinctively want to avoid a loss, and that's why the loss frame works best here. It's nothing to do with whether it's a positive or negative message. It's about the desire to avoid a loss. It's how insurance companies work. And you can only avoid a loss if you don't have the loss in the first place. It's about trying to prevent the loss rather than coming to terms with the loss. And that's an important distinction. So it's interesting to discover that our own messages for hearing care are currently framed backwards. We're essentially asking people to gain a loss or come to terms with the loss rather than avoid it. Because when people have their hearing checked at the moment, it's all about discovering or gaining a loss, namely a hearing loss, as well as all the implications that that might have for someone, such as, I'm getting old. In other words, another loss, a loss of youth. So instead, we need to ask ourselves, what loss can people avoid by having their hearing checked? What loss can people avoid by wearing hearing aids when it's appropriate? Answering those questions will tell us what our messages need to be. Let's quickly finish by looking at some examples of language and messages within hearing care that automatically generate an avoid response. Hearing loss. Well, as we've already seen, humans instinctively avoid loss. Hearing impaired or hearing impairment. We avoid a damaged self-image. Going deaf. We avoid threats, for example, having no hearing. Hard of hearing. We avoid being labelled negatively. Look at this message. What's the thought process we're triggering here? Have a hearing test with our hearing aid audiologist. It means you only need a hearing test if you need a hearing aid. So if you don't want or need a hearing aid, avoid the hearing test. A hearing test will establish whether you have a hearing loss. This means you'll find out if there's something wrong with you. So if you believe, as many do, that what you don't know can't hurt you, you'll want to avoid the hearing test. Also, if you don't feel there's anything wrong with your hearing, which is something we frequently hear within hearing care, you'll also avoid. If you are over 55 or over 65, you should have your hearing tested. This means it's an age thing. So it perpetuates the myth that a reduction in hearing is a sign of getting old. So people will naturally avoid a hearing test because either they see it as a threat to their self-image, in other words, they don't want a reminder of their age, or the age restriction there will mean it doesn't apply to them. So that brings us to the end of this presentation on how we change attitudes to hearing care. But there are 5 key principles to remember as we begin the work of changing people's attitudes to hearing care. Firstly, attitudes are often not fixed until they become relevant or are put to the test. So with the right ingredients, they can be shaped. This applies to hearing care too. Secondly, how relevant something is will directly affect the way someone forms their attitude. Relevance governs whether they use ready-made attitudes, such as following the crowd or how attractive the message bearer is, or whether they make their attitude from fresh, raw ingredients, such as weighing up the pros and cons. It's up to us to ensure that we're relevant, and that the messages we present are easy to remember and easy to apply. Thirdly, it's not ultimately about what we say. It's about the thought processes that take place in our audience as a result of what we say. So we must always be thinking about what impact our words and messages will have. Fourthly, using the right word is like using the right bait. We can determine which thought processes are most likely to come to the surface. So remember those rules we looked at: sticky messages, repeated associations, our audience's prior thoughts, labels and stereotypes, the way we frame things. Fifthly and finally, we need to consider what our audience should be avoiding and what they should be approaching. Then we must make sure that our words and our messages affect this. Putting these 5 principles into effect will go a long way towards modernising society's attitudes towards hearing care. But we must remember that ultimately it is only by us working together with a unified purpose and a unified message that we can move the otherwise unmovable. Attitudes to hearing care can and will change, but it's up to those of us within hearing care to take the lead. Thank you for listening.